Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to yet another video. In this video, we're going to be talking about something very interesting. We're going to be talking about patella malalignment. Have you noticed that your kneecap keeps coming out? You've had an injury or not an injury, but you notice that the kneecap goes out and comes back in. So why does this happen? And how do you treat it? So firstly, you need to remember your knee is made up of three bones: the thigh bone, the leg bone, and the kneecap. And there are two main joints: the tibiofemoral joint, which is between the thigh bone and the leg bone, which helps in movement and takes the body weight. The second is the joint between the kneecap and the thigh bone. So this is the lever of your knee. It gives you mechanical advantage. It gives you the power to jump, to run, to do any kind of sporting activity. It has the thigh muscles or the quadriceps attached to the kneecap on top, and a rope at the bottom of the kneecap, which is called the patellar tendon, that attaches it to the leg bone. Now this kneecap is convex and it sits on a concave thigh bone. So it moves like a railway engine wheel on a track. So the concave or convex articulation or joint keeps the kneecap stable. Apart from that, the kneecap has ligaments on either end. One is called the MPFL on the inner side, the LPFL on the either side. On the outer side, there's the muscles, the quadriceps muscle on the inner side called the vastus medialis obliquus and the vastus medialis lateralis, the rectus femoris. These muscles stabilize the kneecap. They are playing tug of war. Both are winning, so the kneecap is at the center. Sometimes due to excessive force, like an injury in sport, road traffic accident, these ligaments can tear, so the kneecap goes out easily because one of them tears. More often than not, the kneecap goes out outwards because the inner ligament or the MPFL tears. In that circumstance, just reconstructing the ligament, that is making a new ligament, either by taking a spare part from your body called an autograft, or I use synthetic grafts also, which are great. Nothing's taken from the body, great results. This is stabilized because it acts as a check-in mechanism and prevents the kneecap from going outside and restores biomechanics. Sometimes the kneecap goes out because there is a congenital or alignment related problem, either with the whole lower limb. So suppose the patient is knock-kneed, that is, their knees touch against each other. The forces act in such a way to pull the kneecap out. So correcting alignment is of primary importance. Some people, the alignment of the kneecap with the leg bone is not in a straight line. It's slightly towards the outside. That makes the forces act outwards, which make the kneecap go out more easily. We call it an altered TTTG ratio because this tibial tuberosity, which is a bony prominence in the front of your leg where the patellar tendon or the rope that connects the kneecap to the leg bone is attached, is a little outwards. Sometimes the kneecap is excessively upwards, meaning if you notice, this groove starts from about here, but above that there's no groove, it's flat. So imagine if the kneecap is very high, then it can easily go out because there's no concavity in the thigh bone or the trochlea. This is called patella alta or a very high riding patella. And in some cases, the groove is not deep enough. It is flat, so the kneecap goes out easily. In these situations, what we do is, if it's patella alta, we bring the kneecap down. If it is an altered TTTG ratio, we medialize the kneecap, meaning bring the kneecap more towards the center. In these, how do you do it? You basically need to move the patellar tendon or the rope connecting the kneecap to the leg bone. However, if you just take out a tendon, healing may be a problem. So you take it out with a sliver of bone and reattach it in the right location, either down or more medial, depending on what's wrong, and fix it with screws. You may also do a ligament reconstruction along with that, the MPFL reconstruction. And in rare cases, we may have to recreate the groove, which is called a trochleoplasty. I hope you understood quite a bit about this, but remember, apart from surgery, physiotherapy is very important in patellar realignment because when you're realigning something, muscles work differently, so you need to condition them. So strengthening of your quadriceps muscles, thigh muscles are of paramount importance, whether an operation is done or not, which is done by a physiotherapist. Recovery in most of these operations is by about 3 months or so. I hope you've understood quite a bit about patella maltracking, realignment. If you like my video, please like and subscribe to my channel. And for those who like Hindi content, we have a very popular Hindi channel with a silver play button. Please like, subscribe and follow it. Thank you.